Hi, I'm Dr Anthea Rhodes, paediatrician here at the Royal Children's Hospital in Melbourne and your host for the Winter Wellness series of the Kids Health Info podcast. Well, winter is a very common time for kids to get sick, and parents often ask, how can I prevent this and what should I do at home once my child's unwell? So here today to answer some of those questions is Dr Linny Phuong, our infectious disease specialist from the Children's Hospital. Welcome, Linny.
Thank you for having me.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
So, Linny, one of the things that we hear from parents all the time is, why are my kids constantly sick in winter? You've got a little one at home, you know what it's like. What can we tell them about this?
Yeah, absolutely. So I think firstly, children are more likely to get sick because their immune systems are still developing. And then in winter, the reason why children are more likely to get unwell is, I guess, we're spending a lot more time indoors. And if you think about it, when they are going to childcare or going to school, they're going to be exposed to other children. Everyone's inside, everyone's sharing. Perhaps hygiene isn't the best. So there's a lot of sort of spread of infection in those particular settings.
Okay, so it's not just that the bugs are only around in winter, but it's also that we're all close together and they're more likely to spread from one person to the next.
Yeah, definitely. So in terms of if you think about people coughing or sneezing or even talking, you're sort of spreading droplets of viruses, and so that can sort of go between people, but also they're landing on surfaces. So think about, shared toys, doorknobs, surfaces, that sort of thing, and that's where that sort of sharing and hygiene is really important and can cause infection to spread.
Okay. So parents often ask, but it really feels like my child's constantly sick.
Yeah.
There must be something wrong with their immune system.
Yeah, of course.
They've been sick for months on end. Can you tell us a bit about that?
Often as they're entering sort of childcare for the first time, for example, or entering school, they are getting exposed to lots of different things and their immune systems are still developing. So certainly what we see is that kids can get sick up to sort of 10 to 12 times in that first year, and that can be normal. I guess the thing with winter is because of that sort of constant contact indoors and that spread, it feels like it's a lot worse. And so, what it comes down to is really, as much as possible, trying to improve their hygiene, easier said than done, but also trying to vaccinate where we can to minimise the spread of illness and try and decrease those complications as well.
Okay, so it's a series of infections, one after the other, that can really lead you to feel like your child is constantly unwell.
Yeah.
And parents then often ask, well, what can I do to boost up their immune system?
Yep.
Particularly, what about diet? What about vitamins?
All the normal things that parents are doing in terms of being able to give their child, a balanced diet, making sure they're getting plenty of sleep, getting some outdoor activity and play, and that hygiene is really important. And then obviously vaccinations where possible.
So getting back to that question of vitamins, is there any reason why a parent should perhaps pop their child on a multivitamin for winter? We often hear, that'll boost up their immune system, stop them from getting sick.
There is limited evidence for, the use of things like vitamin C, zinc, and even vitamin D in particular settings. But certainly if your child is having a balanced diet and they are otherwise well, there's no sort of need to go out and purchase those additional multivitamins. They really, all of those vitamins and minerals should be part of a normal balanced diet. Okay,
so you mentioned as well preventing spread. So obviously once you get a bunch of little kids in a room, you can just see the germs flying around. Yeah. What advice have you got about stopping the spread?
The things that we often think about are hand hygiene. So, we talk about washing your hands for 20 seconds. Again, really easier said than done. Making sure that when they cough and sneeze that they are, coughing into their elbow or into a tissue and then throwing that away. Making sure that before they eat, when they're playing with their pets or going outside, coming back and doing that hand hygiene again is really important. And then staying away from school or from work in the setting of adults when you're unwell is really important too.
Yeah, so that leads to a really great question. Parents often ask, well, how long do I really have to keep my kid home? It's really difficult. I've got to get to work. Surely they can head off to childcare. Surely they can go to school.
Yeah, this is such a challenging question. Certainly when you are working and trying to manage your household, it can be really hard when your little one's unwell. Some of the signs that we often will tell people to keep their child at home will be obviously if they've got a fever, so a measured temperature over 38, if they've got a persistent cough or a runny nose, because certainly that can spread to other children and even other adults. If they're really not back to their normal energy levels, and that's a problem. And then in the case of gastro, vomiting or diarrhoea, the rule is generally 48 hours after those symptoms stop before they are less likely to pass it on to other people.
Yeah, so it's a team effort, isn't it?
It's a team effort.
We've all got to play the
It's
game so that
huge.
we're not picking things up and then passing them on.
Exactly, that's right.
So you mentioned vaccination, immunisation. So where can things make a difference there?
So vaccination's really important because it trains the immune system. So not only does it protect the individual child who's getting the vaccine, it also protects the community around them, which is quite important. The childhood immunisation schedule, which is basically the scheduled vaccines for all children, happen at different time intervals and can protect against some of the winter illnesses, including pneumococcal disease, measles and even whooping cough. And then there are additional vaccines, so things like the flu, which we recommend every year. And then now there's RSV vaccines. So what we recommend with RSV is that there is a program for pregnant women to protect their newborn babies up until 6 months of age. And there is also a product available for young infants, so newborn babies, as well as children in their second year of life, to protect them against the RSV season as well.
So a really good time as we enter winter for parents to check in with their local doctor or their maternal child health nurse to ensure they're up to date with all those regular immunisations, and also they've taken advantage of any extras that their child might be eligible for.
Absolutely. Always important to check in with your GP and just make sure that that you are sort of staying on top of those milestones, because it can get really, really difficult when you are so busy juggling your family and when there's sick kids around.
Lots of great information there, Linny. Can you give us your top tips for parents as they're heading into winter this year with their kids?
Yeah, of course. I think there's a few things to be mindful of. Firstly, that to expect that your child unfortunately will become unwell, and that, it's really common as they're building their immune systems. The second is to try and teach those, hygiene habits really early, so washing hands, that cough and sneeze etiquette that we talked about before. And then also just having a backup plan for what you're going to do with your children when they are unwell. It's really hard for working parents. So, have you got some other alternate form of childcare? What do you do with your work days? And then the last thing is to make sure that you've got a local doctor that you can check in with, because sometimes it's really unclear whether or not they're getting better or worse. Sometimes you need that reassurance, and sometimes you need to know what is next.
So helpful. Thanks so much, Linny. And we've got a whole series of episodes coming up to unpack a lot of those common illnesses and winter conditions that we've talked about today, from RSV through to COVID through to gastro. So parents can tune in for the next few episodes to get some more great advice. Thanks again for joining us today.
Pleasure. Thank you.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.